So one of the unique things about genetic counsellors is that our training is across the breadth of genetics, across a breadth of conditions affecting different health problems, from cancer to neurological conditions to developmental delay to progressive conditions that might shorten lifespan. Many genetic counsellors will have training in grief and loss. We have training in family systems, and that makes us very adaptable to help individuals, bringing together not just the scientific and genetic information, but to use our counselling skills to think about the psychosocial impact, the burden and all the emotional side that clearly has an important impact on how patients respond to the information, how they can adjust to the condition and the decisions that they need to make. Living with the burden of a genetic condition affects the family as a whole, and individuals need to find ways to share that information in their family, communicate to their children in a timely and appropriate and supportive way. And families often struggle with this, and genetic counsellors have a lot of experience in helping families think about the best ways to communicate, helping them identify who in their family needs this information and to support that communication process. Patients who carry genetic conditions can often describe a sense of guilt that they may pass that condition down to their children. And this patient of mine was coping not only with his own terminal diagnosis and the knowledge that he wasn't going to be around for his children, but wanting to be part of and support the knowledge around their genetic status and their risk of carrying the same gene as him. 3 out of the 4 children unfortunately had inherited his faulty gene. When the children got to an age when they were old enough to hear about the gene and to start to understand that they needed screening for a condition that had affected their father and had in fact meant that they had lost their father at a very young age. I'd also worked with his cousin who had come forward for genetic testing, and she'd been found to carry the gene in her late 30s. I worked very closely with a cousin who had had a lot of difficulties as a child around abuse, and she had really struggled with going for cancer screening. By the time she felt able to approach cancer screening, unfortunately, she did have a cancer and it was already very far progressed. It's a hard one for me, it's one of the ones that sticks in my mind. We may say from a guideline point of view that's a straightforward situation. You have a gene test, you go for screening. The reality for families is very different. Fears and anxieties around cancer, if their relatives have died from cancer or cancer's been missed on screening. There are so many different reasons why making those choices, acting on that genetic information is very complicated, and our role in translating that information within their personal context, within everything that's happened to them over their lives, to really help and facilitate care plans and care for families is something that we're skilled, we're practiced, we have the time, we spend time with families, not on one occasion, but often on multiple appointments and visits, often over a number of years. Patients' decision making is a continuous adaptation across the whole family. When one person's had testing, if that's been a positive outcome, that might bring the next person in the family forward. So it's like a ripple in a pond, really. Genetic counsellors have been ideally placed to respond, I guess, to emerging needs of the family over the generations.